The effects of schizophrenia. Let's put this in. Oh God, slideshow. What is schizophrenia? Schizophrenia is a mental disorder which can alter a person's perception of reality. This disorder can cause impaired thinking and behavior along with hallucinations and delusions. There are no different types of schizophrenia, but there are different effects of this mental disorder that can be separated in two categories. There's visual hallucinations and auditory hallucinations. Visual hallucinations are less common in people with schizophrenia. These hallucinations can be linked to neurological disorders such as dementia. They can consist of vivid, colorful scenes, religious figures, animals. They can even hallucinate seeing people. Auditory hallucinations are experienced by 60 to 80% of schizophrenics. This can range from normal, clear voices to multiple distorted voices. Auditory hallucinations that are less common include music and hearing noises coming from the body, such as like hearing your own saliva moving in your mouth. Delusions. The majority of people who suffer from schizophrenia experience delusions. These are bizarre, illogical beliefs. For example, someone with schizophrenia believe they are being watched by the government or that their bodies are being taken by aliens every night. Signs and symptoms of schizophrenia. So the main symptom are delusions. Other symptoms include hallucinations, disorganized thoughts and speech, lack of response, excessive movement, lack of emotion, including facial expressions or speaking monotone, putting together sentences that make no sense, and the list goes on. Signs and symptoms of schizophrenia can be grouped into two categories: positive and negative. Positive symptoms are new behaviors that develop after you get schizophrenia, such as hallucinations and delusions. Negative symptoms are behaviors that you did have, but they were changed or affected by this disorder, such as your speech or your emotions. There are 5 A's of negative symptoms: affective flattening, which is lack of expression and emotional responses. Alogia is lack of communication or speech difficulties. Anhedonia is unable to feel pleasure or enjoyment. Sociality is lack of social engagement, and avolition is lack of motivation. The early symptoms of schizophrenia. Teenagers can experience early symptoms prior to getting schizophrenia. Teens who experience withdrawal from families and friends, a drop in school performance, insomnia, depression, and irritability can all be early symptoms of schizophrenia. The causes of schizophrenia are unknown, but what we do know is that for some people, this cause can be a genetic factor. You are more likely to be diagnosed with schizophrenia if you have a close relative with the disorder. People are usually diagnosed with schizophrenia from ages 16 to 30. The most common ages for men is early mid 20s and for females late 20s. To determine if someone may have schizophrenia, the test may include physical exams, drug and alcohol screening, MRI and CT scans, psychiatric evaluations, and the DSM 5, which is the Diagnostic and Statistical Manual of Medicine. Antipsychotics are the most commonly used treatments for schizophrenia. They affect dopamine in the brain and lessen the symptoms of the disorder. Anti-anxiety meds and antidepressants are also commonly prescribed. Many of these medications have negative side effects, which result in compliance complications, such as being reluctant or resistant to continue the medications. Only recently there has been a huge advancement in medicine in medication for schizophrenia, where the antipsychotic drugs can be injected rather than taken orally, and the drug effects can last 30 days. This is a big improvement because the main issue with these drugs is compliance. Some people with schizophrenia start to take their drugs and they assume that they're feeling better because of the drugs, so they stop taking it because they think they're fine. Um, And this is a whole other deal with the compliance issue. To prevent this disorder from happening, there's no way to prevent schizophrenia from happening, but if schizophrenia runs in the family, it is highly recommended not to do any drugs, even marijuana, especially as a teenager because the brain is still developing. Drugs, alcohol, these are all things that can't cause schizophrenia, but they can trigger the onset of schizophrenia. It is also recommended to keep strong social relationships and avoid isolation because being isolated and alone can also trigger the onset of schizophrenia. Schizophrenia impacts daily life. The majority of people with schizophrenia have difficulty performing daily tasks, the most common being shopping, cooking, taking daily medications, handling finance, doing laundry, and housekeeping. So these are just daily life activities that they struggle with, having jobs, um, eating meals, communicating with family. There's so many simple things that schizophrenics have a hard time with because of their disorder. The common behaviors for people with schizophrenia commonly have delusional, irrational thoughts, such as thinking the TV is speaking directly to them. They may also have conversations with people who are not actually there. If schizophrenia is left untreated, the severity of the symptoms can worsen and cause more mental health issues, such as psychosis. Those who experience psychosis have higher rates of suicide. The ways to cope with schizophrenia are establishing a support system. This can be family, friends, and pets. Support groups, meeting other people who are suffering from the same disorder so you feel like you're not alone in your head. You feel like you're not alone experiencing all these things on your own. Therapy can help to process and understand the emotions that they're having. Self care, taking a shower, cooking your favorite food, going on a walk, engaging with hobbies. Um, these are all ways to maintain positive thinking to cope with schizophrenia. Historians have led to agree that Vincent van Gogh actually suffered from schizophrenia. This is based on his reported visual and auditory hallucinations and psychotic episodes which worsened the last 2 years of his life. This can also explain all the interesting drawings, maybe all these movements, like the flowing in the picture, are things that he hallucinated in a different way that he perceived the world. Violence with schizophrenia. John Hinckley Jr. was a famous schizophrenic who tried to assassinate Ronald Reagan. Four out of 6 schizophrenics are violent. However, schizophrenics make up less than 1% of murder cases. And these are my references. Thank you and have a good summer.